guys like, because a couple people are still missing and settling in, if you like, you can grab a plate, grab a cup of coffee, right in the center of the lobby, like where you came in. If you go to the left, there's a washroom. There's also a back washroom. You'll see some signs. There's bottles of water. So go ahead and settle in. Extra pillows, blankets, whatever you need to be comfortable for a bit. Kind of the objective here today is to go over some research and how it works in regard to acupuncture and its mechanisms. Because, it's kind of an unclear thing, like in the public view. I mean, what do people really know about acupuncture? They're sticking me with needles, and I have no idea why or how this works. And that's always a really loaded question. You always get asked, well, how does that work? It's like, well, boy, that's difficult to simplify, I suppose. So I'm going to do just a quick intro. So I'm originally from Maryland, and I've been a massage therapist for, I guess, about 11 years now. And I've worked in some physio clinics, and I've worked on my own, and I've worked in a lot of pain management. And I actually ended up in acupuncture school in Maryland for a couple of years at MUIH, and where I got interested in this whole acupuncture research topic. I studied under Dr. Zhu, who is a neurologist and an acupuncturist, and he fortunately had a lot of interesting colleagues in the research community, and he would come and we would have these nice discussions and research presentations, and a lot of it was about acupuncture and pain management. And that was quite a long time ago. With the research he was going over, and in fact a lot of it wasn't in English at the time either, so he would have to translate it. It was sort of difficult to pinpoint good and clear research and results and conclusions and things like that. So fast forward, I meet Jeff, and I end up moving to Canada, and I go to school, or I went to school rather, at CCA TCM in Bedford, and I graduated this past fall. So I'm now finally a registered acupuncturist. So I kind of wanted to go back and address this topic again and kind of see what was out there, how things have expanded. And I'll say this, there's a lot more interesting research out there, a lot more research in English. There's a lot of meta-analysis out there where they've taken groups of studies and they've reanalyzed them and really drawn some more clear conclusions versus before you'd see these things. Well, we found this, but there's still a lot of inconclusive things going on. So it's really interesting how that's changed, and I feel like it's important to put that out there, so we kind of know what we're dealing with and why. And that being said, I'm really grateful I got to study under Henry, because I had this question as to, okay, why am I doing this and how does it work? It can't just be magic, so anyway, I'll try not to get on a soapbox too much about that. I just feel that it's more fair and ethical as a practitioner, and when you're approaching somebody's health, that you have tangible information as to what you're doing and why and how it works. So I'm going to give a little bit of background as to how I sort of went from point A to point B with looking at the body, looking at pain management. How did I kind of come to that point? And then we're going to go over some of the research, the mechanisms, and all the interesting results that are out there. So, hi, you can have a seat. No, you're fine. So, as I said, once again, sorry about the lighting, but I'm going to be reading the majority of this anyway. You might be able to see some images. So, I guess a big part of it for me is it kind of started with just understanding the human body and its design and how it functions in general. So, over the years as an RMT, I've continually sought to understand the system that is our human form, starting with the systems of our bony structures, musculature, and connective tissues. Over time, I found that there's this natural progression to seek even more in-depth understanding in regard to relieving pain. I found myself in a never-ending process of understanding pain, its effects, and how and why practices such as massage and acupuncture are seemingly effective for the common plight of many people. explain how I became interested in becoming an acupuncturist. I cannot avoid the fact that my background is structural massage therapy has greatly influenced how I view and treat the body as a whole. Structural massage approaches the body and its gait, structure, postural patterns, fascia, and connective tissues. It views the body and soft tissues in an encompassing way that extends beyond the treatment of localized trigger points and pain, so not needed. Over the years, I began to heavily depend on these approaches to treatment for pain, as I found that earlier in my massage career, I sometimes would find a stall in treatment progress. So I started kind of, even in the massage capacity, how can I do more? How can I view the body in a more gestalt way, I suppose? Over time, I started to focus my career development and continuing ed on courses and literature that addresses the body in terms of structural integration to improve overall function. A creation of homeostasis, and I studied some role-free literature over the years. The early modern Western understanding and perspective on the body's response to pain and the electrical processes stem back to early neurology and psychology. An interesting transition of these findings and understanding created a surprising platform for therapies such as structural integration, role-play, osteopathy, and so on. During the mid-20th century, pioneers of psychology, chemistry, and physics have attempted to find solutions to what were considered family health problems, which could be physical symptoms, but the combination of stress, of poverty, family growth, meaning too large of a family, economic circumstances, particularly in Europe during and after World War I and World War II, appeared to be exacerbating existing health problems due to the stressors of families and communities, creating a crisis within a family structure. One Austrian psychologist who sought to understand and relieve these problems was Dr. Wilhelm Reich. He initially studied under Dr. Sigmund Freud. He was one of the early psychologists in Europe. Due to political pressures leading up to World War II and the corrupt nature of the International Psychological Association during wartime in Central Europe in particular, Reich was effectively pushed out as his theories of integration of touch was a major factor that was considered following. Reich's approach to his patients and their physical presentation, character armoring, or character panzer, and tension of muscular tension that holds and guards emotional blockages of the body. He had a theory and a practice called vaginotherapy, which incorporated massage techniques to release tension that he was finding when somebody was experiencing a lot of stress or psychological trauma. He later in his career started to explore the theories of bioelectricity in the body, which I'm going to segue into a bit of that in the Western terms. Bioelectricity is a force that dictates that we are living beings. The nervous system is the control panel, and the cardiac current is the power plant in a simplified sense. For example, two meta-analyses concluded that amplifying the natural wound current with electrical stimulation, say on that tissue, prevented them from getting worse and even healed some of the worst ones. A good example of this is diabetic wound healing, and where they've used these electrical currents. The human body runs mostly positive ions, and the electrical signals from our brain, cellular changes, and cardiac electric function, and so on. Acupuncture is one method of introducing healing effect of negative ions to create homeostasis in the body and allowing it to heal. Results show that a conductive needle protruding into the surface in an electrical field will cause more ions to arrive at that surface. It was also found that it's possible to measure polar conductivity and concentration of negative ions, so meaning that they conducted experiments where a needle was inserted into the tissue. And it's a conductive material to begin with. We used, these sterile steel needles, right? And that they were able to kind of measure that electrical field. As I said, they have a lot more technology than they used to, a lot more fMRI technology, a lot of other ways they can measure what's actually happening with the tissue, with the neurological system, how acupuncture works, to kind of sort of break down the walls of the mystery there a bit. So in effect, acupuncture sort of contributes to the anatomical organization. So a good example of that is a salamander. You all know when you cut a salamander's tail off, or he loses his tail, that it will grow back in the same place unless something is disruptive or purposefully changed, say in a laboratory environment. His natural organization of his cells and the ions that contribute to that organization of his body it's going to appear in the same place. So the studies that they did with the ionic measurements of healing tissue with the diabetics, it's kind of that same principle to try to get that tissue to regenerate in a functional way as it should be in order to heal. I guess as I segue out of like the massage department with this, there's an Ida Wells quote that it's not how deep you go, it's how you go deep. You know, it's not so much about forcing and breaking down that tissue. If there's a dysfunction, like say, you know, an entire quadrant of a body, it's always more than just like a knot. You know, oh, I got a knot here, but then you start getting neck pain, and you start getting a headache. It might go down your arm, you might have tingling. You kind of get this whole snowball effect of what's happening there. So it's a bigger approach to the body than, oh yeah, I broke down those knots. That's a temporary approach to the body in a sense. So structural integration and Rolfing principles of Ida Rolf. She was a biochemist who created much of structural integration. And we approach that today. These older, early and mid to 20th century theories are oftentimes rehashed and changed. They just call them different things nowadays. However, the understanding of the body as a homeostatic and electrical machine very much touches on the understanding therapists have of the human body through education and hands-on experience. So for instance, just in regard to like musculoskeletal conditions, she created this to basically explain like how this works in regard to looking at a whole imbalance other than just, I have this little spot and it's a knot and it hurts. This is an example of a toddler patient that she was looking at. And as you can see, he's got a hiked up shoulder, he's got rotations, he's got some inversions in his feet. So his structure is out of balance. But with the treatment principles of looking at things more in a holistic sense or a myofascial sense, it's sort of reorganizing how his body functions and works and correcting his gait. And maybe as he's older, unless something happens like an injury, an accident, we all go through different things in our lives, that he at least might get a little bit of a better start with how he moves his body. There's more homeostasis involved. And that's just an example, just because we all can relate to this, of different sorts of postural things that we all experience, right? It's a way of looking at it. We're only, oh, I'm just gonna get this little knot right here, you know, break that up. We're not looking at the whole picture. Okay, that's wordy. I'm gonna skip that. Okay, so this I think kind of encompasses how I look at all of this kind of medicine. All this metaphysics is fine, but be mighty sure you've got physics under the metaphysics. Okay, so the connections of East meets West in understanding the body. The principles utilized in massage therapy, especially those that view the body as a self-regulating bioelectrical system that houses our soul and our mind, overlap with a lot of the principles of traditional Chinese medicine. It's fascinating how Western psychologists and body workers came to the similar conclusion about the holistic, interconnected body as the ancient Chinese did over 2,000 years ago. So once again, sort of looking at, I'm not sure how clear that is, but this is like an acupuncture meridian, right? And it overlaps with like our myofascial lines, which are these connective tissue sections of the body. So say perhaps this guy here, we all know like what those big, heavier like muscle tissue looks like, right? But there's this connective tissue that makes all of that interconnect and move with each other, or else we wouldn't be able to move these things very well. It's not just muscle and bone, there's this other element to it. And interestingly enough, they've been able to kind of map out where there's this overlap with that bodywork approach and the TCM meridian approach to those channels of the body. Even the concept of substances existed in antiquity and well into the 18th century in European medicine. But the concepts that overlap with what we would call qi in Chinese medicine were not established in a concrete manner until bioelectrical perspectives were applied to mind-body approaches in body work. So there's like this little bit of overlap with Chinese Chinese medicine. Like, they looked at the body of having these dysfunctional humors, and we look at some similar things, but they kind of pan out a little bit differently. So we'll look at like damp, and we'll look at blood, and we'll look at these other things. So it's interesting that these different parts of the world sort of had like these little bits of overlap. So there seems to be like there's some kind of truth to a body that's out of balance, and how do we find ways that overlap that maybe work together to correct that imbalance? So what is sorry, I'm just totally in the way of the slides here. Acupuncture is a branch of traditional Chinese medicine that uses solid, sterile needles to pierce the skin in specific zones called acupoints, which lie on meridian channels that correlate with different organs, functions, muscles, nerves, and health conditions, and even psychosomatic issues. The needles are stimulated by hand or with a TENS unit. An acupuncturist will complete a detailed intake, reviewing all of the patient's body systems to create a specific plan. So it's very much tailored to the patient's presentation, what they tell us, and what we see. We put all that together. Qi is a circulating life force that is housed in any living being. Sort of overlaps with that bioelectrical idea. The concept can be equated to that Western understanding, bioelectricity in the human body, and chiefly in our brain and its electrical pulses, which govern different areas of the brain and how those things function. Acupuncturists seek to create balance, flow, and correction of these signals by accessing qi with acupuncture needles. Dead qi is sometimes the visual and mostly physical sensation felt by patients at the site of the needle or related to that pathway. So, for instance, you always have to explain this to people that they might feel the sensation during treatment, but everybody's experience is different. So some people, they'll feel a warmth around the point, or they'll feel a zinging like outside of the area that you needled, which can follow a nerve pathway, a myofascial pathway, an acupuncture meridian pathway, and a lot of times they overlap. So it's interesting. So there's a definite physical response. The standard acupuncture nomenclature published by the World Health Organization listed that there are about 400 acupuncture points and 20 meridians connecting those two points. Alright, so acupuncture research has been approached from many angles and methods. Few methodologies have been tested numerous times over the years to attempt to address issues within data. Over the last decade, the most convincing and thorough neural research has been reviewed further and expanded upon. These revisions and reviews have bolstered the efficacy of acupuncture, especially in regard to pain management. So one theory that Dr. Hemming was quite fond of, and I think this research makes a lot of sense, is looking at pain in regard to dermatomes. So a dermatome is an area of skin in which sensory nerves derive from a single spinal nerve root. These areas provide signals to the central nervous system. They're embryonic in origin, meaning that we're born with them, and they initially branch off from the neural tube, which develops very early in our existence, correct? So, an interesting example that he applied in a clinical sense is he had a colleague who had an onset of shingles. This happened like before they had the vaccination to try to manage that. So when hers was set off, it was quite severe, and the way she described it was like the entirety of her spine was on fire. It was all of her spinal nerves would fire off, and it was pretty much chronic. She had very little relief from it, and this is a woman who worked at Johns Hopkins. So she obviously felt that she hit a wall and wasn't getting any help for the pain management with this situation. So when she would come in and give lectures, what he would do clinically is he would, because all these spinal nerves branch off the spine, and we needle right in those zones of these like peripheral edges, he would needle her spine, and he would hook it up to a TENS unit via the needle itself, and he would give her comfortable enough stimulation, and it would just sort of turn that signal off that was going to the brain. And it was a really good real life example of how we can address pain that was coming out of like the spinal nerve. So that seemed to make a lot of sense to me in a real world way. So yeah, that's just these images are terrible with the lighting. So for instance, in Chinese medical terms, we were looking at dermatomes and the spinal nerves in the TCM sense. We have these points where we would needle. So for instance, this works with the lung, the heart, spleen, the kidney. But nonetheless, all of these still rely on these nerve pathways. So it's just one of those interesting layers of how, you know, those TCM principles overlap with our Western understanding of our anatomy. Yeah, so the dermatome hypothesis, when pain is referred, usually from a structure that has developed from the same embryonic dermatome as the structure where the pain originates. So it even can correlate with some visceral pain, depending on where the innervation is, not only just the spinal pain. Let me see. Alright, so another thing that he went over a good bit, that they've expanded the research on this quite a bit as well, is the role of trigger points in relation to acupuncture. So yes, I know in the massage sense, I say like you can't always just look at trigger points, but this is where acupuncture is interesting, because if you needle an area that happens to be on a trigger point, that acupoint is within that pathway, within that meridian. So it's inherently going to sort of address a longer chain of where this pain is coming from and what that dysfunction is, whether it's pain, if it's musculature, if it's something related in the TCM diagnostic sense. Nonetheless, it's addressing it either way, and that's what's sort of interesting about that.
Could I ask you a question? Sorry.
Yes.
Trigger points.
Yes.
In the body.
Yes.
So I don't know that I understand what that's.
You know what I hit a knot?
Yes.
That's what that is.
A trigger point.
It's a trigger point.
Okay.
So it's just that metabolic junk that sort of gets in our muscles. So in the massage sense, like yes, it's great to break those up, but if we're not kind of looking at the related issues with the rest of, say, like a shoulder quadrant or something, we might be missing the mark a little bit with more relief. So with acupuncture, you're inherently, if you're needling one spot in a channel, you're inherently sort of having this proximal and distal effect around it. So that's where it's sort of interesting, where you can kind of layer in that idea, but then layer in the action of acupuncture, and it can kind of. So what they look at with the research with this is that a lot of these trigger points are on the same areas as acupoints, like very, very close or sometimes exact. And some of the research that we had went over with Dr. Hemming was a little bit aged at the time. And that's where reviewing these more recent meta-analysis was interesting, because they went back and sort of readdressed it to pinpoint, okay, how accurate is this? And there was some pretty interesting results.
Excuse me.
So, yeah, so that's what that is. Sorry.
Yeah, thank you.
Yeah, no, of course. If I'm confusing, sometimes I'm just reading and not paying attention. So, anyway, so right. So a lot of us have experienced a trigger point, a knot, something uncomfortable in our bodies. These nodules may be responsible for a vast number of conditions, range from headaches, toothaches, jaw pain, sciatica, low back pain, abdominal pain, angina even. Some people think, why do I have this chest pain? So they can, and here's a good example of, sort of like where the trigger points are and where pain can refer. And once again, they've been able to, now that we have better MRI technology, they've been able to look at the TCM approach to these same areas and the referral pathways, but look at it as an acupoint and meridian pathway. So it layers over very nicely, and it's really interesting how they've been able to kind of measure those pathways and how similar they are. Another good real world example, I know this isn't the best image, is, it's sort of not an accident that when somebody has myocardial infarction, right, and this is representative of what we call the heart meridian in Chinese medicine, the internal pathway is in the visceral heart organ itself, and the referral pathway, in Western terms, you say, you get that pain down your arm, it follows this pathway, and it directly follows that sort of on our side, all the way down. So that's an interesting overlap of this ancient understanding of the body, but it seems to correlate with what we experience and understand the body now. Okay. Yeah, so here's the older research. So that's a Malzek and his colleagues that study. It was initially conducted in 1976, and they coined it as having a 71% clinical corresponding rate of pain patterns comparing the trigger points where they were located and the acupoints. Now, at the time, because it probably wasn't quite as precise, they said the study shows 100% spatial pattern correspondence within this, I think they called it a 3-centimeter radius. But we're going to go over the more recent research and how it's a little more correct. It's not exactly 100%, but at the time. It was hard to measure these sort of things. We didn't have the same, as I said, MRI technology and things like that. So that's how they approached that. A good example from some of these studies, though, was the accessory nerve 6 branches of the cervical spine 3 and 4 and gallbladder 21, which we needle a lot for headaches, neck pain, shoulder pain. Sometimes you just get this block up right where your neck and your skull sort of meets. That's a common acupuncture point that we use. So they found that the overlap of where those nerves come through with the more modern studies, that needling that has a really profound effect on relieving that nerve pain or compression or the things that are creating this pattern of problems with headaches and neck pain. For instance, people with occipital neuralgia, they have a lot of problems right in that zone, and that's the primary region where we would needle. In fact, that's where they do the injections for drugs for occipital neuralgia. It's right on gallbladder 21, which is a little more aggressive than an acupuncture treatment, and the needle is a lot more harsh. So it kind of gives people maybe another option to address that without maybe having to get this giant injection in the base of their skull. So yeah, this is, as I said, a good example of the MRIs where they're able to sort of measure these pathways. As I said, I know the light is so bad in here today. But right, so this is a common area for a trigger point, and then there's large intestine 17, which we would needle for that pain pathway. Same thing with the hip, the gallbladder 2930 in this region of the hip here, and where it would sort of move down through here. Okay, so I'd say some of the best research in regard to this is this research by this guy named Dorscher, who at the time, when I first went to school, reviewed some of his older research, but they included his work in a recent meta-analysis that really sort of fine-tuned the outcome of his work. So he used a similar method of qualitatively comparing acupoints and trigger point locations. His research also concluded a high correspondence rate of an 81% correlation, not 100%, right? But as I said, we have a much more precise way of sort of addressing these things than we did in 1976. The study was averaged by analyzing 238 trigger point locations, so a pretty good sample size, not just a few little blips of information and these sort of fuzzy conclusions. So once again, just pointing out that the 100% correlation isn't really accurate. Alright, so I actually found a recent piece by Dr. Hemming and his colleagues And in the abstracted states in brevity that both methods of inclusive TCM acupuncture and focal use of dry needling should be compared and contrasted, and training should overlap to help patients receive effective and safe treatment. So Dr. Hemming, I studied with him in 2012 to early 2014, and this was published in 2016, so he's still working to try to fine tune the overlap with how we address this. And there's this big debate in the acupuncture and physio communities of, you know, is acupuncture the same as dry needling? Is dry needling the same as acupuncture? And the way that his work outlines it is that it definitely has value. The articles coined something like, I think I don't maybe it did, that dry needling in effect is a form of acupuncture, but I think where there's kind of the mark is missing is that they're not maybe following the best protocols for needle cleanliness and stuff like that, and there's been some kind of debates about it, but instead, and his work was basically saying, okay, instead of fighting each other on this, let's sort of standardize how we address this, and then we can help patients more effectively. Let's communicate on this and understand that both methods do help in regard to pain treatment, but we need to sort of communicate about this thing.
I'm sorry, I have another question.
Oh, yeah.
Because I've had acupuncture before,
Yeah.
but would that be the dry needling you're talking about? Just the very tiny needles that they place in various spots?
Was it through a physio clinic? With a physiotherapist?
No,
Okay, then you would have had
it
it
would like been a homeopath.
Depends on how they were trained. If they took acupuncture training, like with an acupuncture program, then they were needling in like a TCM sense. Or they could have taken these really short courses that physiotherapists take and they add it to their practice. So
Oh,
it may have depended on where they decided to train. That's a
so
big
that's
part.
dry needling though.
If they're just going, saying, okay, you have shoulder pain, we're gonna needle where it hurts, and that's it. There's no other, there's no other assessment, and there's not like a further conversation of what else is going on in the body. It's very cut and dry to the point. But then there's this, all right, how do these two methods work together, and where are we in disagreement? How do we make this better? You know,
Okay.
in regard to pain management. So it's a big thing, you know, because people can get great results with dry needling, but it depends on how that person's trained. And then you have acupuncture saying, oh, I'm totally against that. And so it was interesting that Dr. Hemming was trying to put all of this together and try to make this work for patients. That's the main thing that we should be concerned about. You go much better, you know.
No, and it's just understanding that there are different types, and there's just not
Yeah.
one type.
Yeah,
Yeah.
no, so there's definitely different approaches for sure. So
Okay.
yeah, and they actually kind of came across how dry needling works by accident. There's this old research was conducted by Bragg and Sigmund in 1941, and concluded that the use of empty hypodermic needles produced these really surprising effects of pain relief. The control group's pain relief was only second to those who actually received the Novocaine. It just happened to be this control group. Dr. Travell was who basically formulated trigger point massage therapy that we use. Dr. Travell had a landmark study in 1952 that correlated the use of dry needles for myofascial trigger points. And there was another study in the 1980s that there was pronounced relief for low back pain and chronic low back pain in patients that received dry needling. So it's like the mechanism, it works, but there was that why and how are we practicing different, how are they practicing different. But nonetheless, there's this ongoing data, and it's interesting because these studies in particular with the almost more of the dry needling method are so old in a clinical sense. So now we're kind of like brushing up, how do we compare and contrast the two, how do we, measure this more accurately. So yeah, so they kind of found that, by accident, really, that it was effective.
Was that their control then? They were actually injecting some people, is that what you meant?
Yes.
And the others they were inserting but not
They were
injecting
empty,
anything?
but they were having these
Okay.
high rates
So that's
of
a bit
pain.
like the sham, when they use sham
Right.
acupuncture, it's still it's not a true placebo, is
Right.
it? Because it has a beneficial effect
Right,
still.
exactly. And that's a whole other issue with the sham acupuncture issue with studies, so yeah. Whoa, wait, skip questions.
I just knew acupuncture, I had a sweet clue that there were so many different kinds.
Yeah, there's a lot of different approaches, and there's this whole other approach to what they call German acupuncture and what
Japanese acupuncture.
what's that?
Japanese.
Yeah, Japanese acupuncture, Korean methods. Like if you meet people from different countries, they all have completely different experiences or training. It's really interesting.
Yeah.
So that's what I mean. Like looking at clinical data is really, it's been a really tricky thing historically with this. And as I said, it's definitely getting better. But yeah, they need information to say like, all right, how does this work? You know, and that's where it's like, all right, what's out there now? What do we understand and know about how it works? So for instance, I thought this was so this is the injury, obviously, and you have your inflammation and pain in this red zone here, that's before the needle was inserted, and then after there's a 5-minute placement of the needle, and then the results after the fact. You can see that inflammation and pain is clear. And that's where it's like, this is some really recent stuff going on. I'm gonna talk a little bit about a really big German meta-analysis. Unfortunately, it's not even published yet. It's like one of those things that's gonna take forever, but they're using a lot of MRI technology to try to understand how it's affected the brain. So another method of understanding how we stop pain with acupuncture. So we think back to the example of the lady with the shingles pain down her spine and how that TENS unit machine sort of turned that off for her. Is if we look at the idea of the gate control theory of pain. So this is a really good kind of visual. So with our central nervous system, we have this like very direct pathway to the brain and how it processes pain and where we're feeling it, right? So if we're going at, say perhaps before this can get to this pathway, while this gate is open, it sends those pain responses to the brain, and then you start feeling the discomfort, and it becomes bothersome for you. That's where with this lady, say perhaps this is her back, we have like a peripheral nerves there, we're going through and taking TENS unit to sort of turn that signal off. That's why it's keeping that pain level down, because it wasn't able to travel through the nervous system, go to her brain, give her those signals that I'm in pain. In a sense, they found that it can break that gateway, and that's what we want with any sort of pain. We want to stop it before it gets to that point and get the pain levels back down. So, yeah, let me see what else I want to do. There's just some like little interesting facts, and just some research results going on in more recent times. So, for instance, there's a study. This is from that meta-analysis thing where they haven't had it all published, but I do have a link for a lecture that they did presenting a lot of the research they're working on. So for instance, they found that acupoints gallbladder 37 and bladder 60 show deactivation in the area of brain that's responsible for basic visual processes. So the stimulated areas are highlighted in red in the graph I'll show you. Yeah, to show that how that changes some visual issues. Yeah, so it's not published yet, but for instance, they're showing these different, can't even really see the colors that well. They're showing these different areas of the brain and how they kind of like change like the brain activity with like visual problems that they were looking at in the patient. So that's an interesting link. I can always send it to people, and it has a ton of stuff like this. And it's like an hour's worth of like the work that they're trying to do, taking like all this old data and all this. Okay, we know that like it stops pain, but how? They're trying to like look at it through MRI technology to see if there's changes in the brain. So, all right. So just some like quick facts. The World Health Organization released a report entitled Acupuncture, a review of reports on controlled clinical trials, which endorses the use of acupuncture for over 200 symptoms and diseases, including low back pain, headache, nausea, vomiting, allergic rhinitis, anxiety, side effects of chemotherapy, and induction of labor. And the U.S. National Institutes of Health issued a consensus statement proposing acupuncture as a therapeutic intervention for complementary medicine. That's right from the World Health Organization. For instance, there was there's an fMRI study, like the graphs I was showing you, where they were trying to measure things with MRIs and pain control. During the clinical experiment, patients suffering from carpal tunnel syndrome were divided into two groups. The first group was given real acupuncture treatment. The second group was given sham acupuncture. It's one that doesn't go all the way into the tissue or it's blunted in some way. So they weren't receiving a real effect. All the patients in the study reported having improved symptoms of their carpal tunnel syndrome. That is that they experienced less pain or discomfort. The patients that received real acupuncture actually experienced long-term improvement of their health, while the sham acupuncture patients did not. So they may have at the time had this like short-term sort of placebo effect, but those that had received proper needling treatment for that had better and long-term results. I do want to touch on NADA, which is a protocol that they use for PTSD and drug addiction, smoking cessation, things in that department. So the whole principle of it is related to our neural response. So as outlined in many of the studies we covered today, there is a distinct understanding in regard to how acupuncture shifts the neural focus and response from a fight or flight sympathetic nervous system response to engage the rest and digest process in the parasympathetic. So I guess before I just jump into a couple factoids about that, when I was in Maryland, I guess it was over a year, I was at the Penn North Drug Detox Center in Baltimore City, and you could see, you have patients coming in with severe addiction issues. They were court ordered, so they had to go. They might not want to be there, so a little resistance there, and you could see sort of everything go from 100 within like 10 minutes drop to like a 0. Sometimes they would even fall asleep and have these massive shifts in their nervous system and how they're responding to stress and stimuli, and breaking that neurological loop that says I need this substance, or I need to quell something that I'm feeling, whether it's pain in a physical sense, a mental sense, whatever that is, that they needed that substance at the time. So this program, it's a 5-needle auricular treatment that was first developed by Wen and Sheng in 1973 for analgesic pain relief purposes. This method was later applied at the South Bronx Hospital for Drug Detox under Dr. Smith and his colleagues. Several programs that they use NADA for are related to veterans care, PTSD, addictions, natural disaster relief. Through this and Acupuncturists Without Borders. They used to not have a lot of support, but they do nowadays through the World Health Organization if there's a natural disaster or a large-scale crisis. And they would utilize NADA specialists in conjunction with other forms of healthcare and therapy. Data has shown that most judges in cases dealing with repeat drug offenses prefer that the offender attends a program with NADA detox support than without it. So, in regard to once again, neural pathways, going into this zone of the ear, with that being said, you have all these innervations that come out from the skull through this auditory pathway and into the face. So a lot of your vagus nerve pathways are through here, a lot of things that could, dictate stress and things like that. So it's almost like a direct hit in some way, as to where it's going. So those are the points that we use for that protocol, and it's very simple. It doesn't take very long. So they've been able to do brain modulation with electrical stimulation of the auricular vagus nerve endings, and that's how they were able to is NADA effective? How do we look at this now? Because when it was first developed, know, at this clinic in the Bronx, it was just sort of on a whim with this little bit of data that they had from Asia, and that's it. So we're able to kind of expand and understand why that's working for those people. Alright, so, just in conclusion, there is a sufficient amount of evidence that acupuncture is valuable to expand its uses into conventional medicine and encourage further studies of its physiological and clinical value. And then I just thought this was an interesting picture because it's sort of, it's just Alex Gray, finds it so bizarre before, but you know, there's like what I would call acupoints here, there's musculature here, there's bones here, there's these meridians, but there's also the overlap of muscle tissue, nerve pathways, sort of how it's, I don't know, it's not the most sophisticated way to put it, but even in regard to musculature, your body's like an onion, it has many layers to it. So when you add in the rest of the systems as well, and given that we are effectively electrical in a sense, you know, so I think this is a good image to kind of summarize what the body really is versus like, you know, this is a really bare bones simplified form in comparison. There's a lot more to it than that. So yeah, I know that was a lot of information. I cut some of it out just to try to summarize there. But yeah, I mean, if anybody has any questions or they want to share any experiences and you know what they think of acupuncture or anything like that, the floor's open. So
Thank you.
you're welcome. Sorry, I read really fast. I didn't even have time to prepare because we were trying to like fix our lighting problem. We were having some like technical issues, so I was like, yeah, I don't really know how this is gonna go.
I do have a question.
Yes.
You're my massage therapist.
Yes.
So I'm totally fine with talking about
Okay.
this cranking knot back
Yeah.
here. So the acupuncture,
Mm-hmm.
like the massage, you're awesome. But in addition to that, would you complement it with acupuncture as well?
Definitely, especially when I find that I'm getting kind of caught in a spot with
Right.
their progress, and that's what kind of pushed me to finish acupuncture school if I was able to. And thankfully, I had the opportunity to do that up here. Because I was actually almost at another physio school. Jeff, even though you're from here, you didn't know about the campus in Bedford at all. We just happened to be digging around when I was working on my study visa, and I was like, oh my god, that's it. Like, I need to go back and finish this because it complements that so well when somebody is in a process where it's just not moving, and it's tough. I mean, people are lucky if they can get into massage once a month. So if I can do something that I can pinpoint it a little more directly, or I can get a little bit more movement in that tissue, or even if it's an area of just like that body armoring concept, just holding it because of
Right.
how we're living life and how our body moves with that. I'd like to try to do that with people to see if I can get better results, more long-term results, maybe see people less, you know, kind of thing. So that's where with massage, I do as much as I can, and I think that's why I really gravitated towards structural therapy. One of my instructors was a structural therapist, so at least kicked that door open for me early on.
Right.
But it's like in the beginning, we're only looking at trigger points, so I hit a wall. And then so I needed to kind of expand into how do I approach the body and massage differently. You know, it's like, okay, I can't really massage a nerve. I can get a muscle to lift off a little bit that's causing that compression, but how can I actually get that nerve to calm down? And somebody maybe has, you know, neuralgia going on. That's whether it's sciatica or carpal tunnel with some burning and numbness. How do I address that directly? I feel like it gives me the opportunity to sort of push treatment further. And I didn't even touch on a lot of visceral stuff, you know, where people, we can treat stomach conditions, gynecological conditions, stress, other things like that. I'm just looking at musculoskeletal stuff, you know, nervous system play into it, just kind of building off, you know, this layer and adding to it.
So would you, for a session, would you just focus on the one area, or if there were a couple of problem spots, would you be able to work on a couple at once, or it would be one area at a time?
I kill all the birds at once with all the stones. That's what's great, and that's what's great about needling, because
Yes.
when people people only have, say, they don't have a policy, or they only have so many appointments, and that's hard for people. I'm trying to find ways to sort of, alright, how can I like give this person relief and knock as many things out at once as humanly possible? So, and that's why I'm slow, you know, I give people at least 90 minutes, I want everything imaginable. If I'm not familiar with their body, I will palpate and try to find, are there physical restrictions in the way, what else is going on, how do I address that? And that's where I try not to get on the soapbox too much, but it comes down to an ethical thing and looking at people actually getting results, because if you're not looking for results or how this works, you can have people come in and give you $1 zillion over, like I'm being really frank right now, over and over and over again, and it lines your pocketbook, but are you really helping anybody?
Right.
So I felt that's why it was important for me to put this out there, so people know why they're getting acupuncture done, what maybe it could do for the body, you know, and how I approach it, where I'm like, I really want people to feel better, you know, so. So just, you know, it's funny because people that I've already seen for massage and just starting to get acupuncture, they fill out their acupuncture intake form like a massage form. So now I'm having to tell them like, no, we can look at other stuff too, because yeah, I don't think people realize all the different things you can address with it. So I try to remind them like, no, if you have a belly problem you've never dealt with, you know, we can look at your back and we can also talk about that as well. So it's a nice all-encompassing thing.
Yeah.
I would imagine that you, if you have massage patients that come in and have different issues, and as they come and you get to know more their story and the underlying things that are causing them, you know, I'm thinking if it's it's stress that's going on that you're dealing with, or you know, even grief and causing a closing in and things like that. That you know, you already must be thinking, oh, well, now I've got my acupuncture, you can address those underlying, deal with the grief, deal with through the acupuncture to stop the reoccurrence and the needing to keep having the massage.
Oh, absolutely, and it's amazing how quickly that door will open for people. Like within the first 1 or 2 acupuncture appointments, following up almost 4 years worth of massage with me since I've been working in Bridgewater, then all of a sudden it's like all the floodgates are open. It's like, well, this is happening and this is happening.
Wow.
You know, maybe making some real progress, you know, further than just, okay, we got a little bit of attention out, see you in a couple weeks.
Yeah, you can
there's
address the actual cause of it. Yeah,
more there. So.
And does age have any part in this? I find now as I'm starting to age, is it just, we get in our head, well, this is just something that's gonna happen, right? As we continue to age, we're gonna, but the acupuncture will help with that.
You mean in regard to like inflammation and pain?
Yes.
Yeah, definitely, and that's where it comes down to looking at the body more holistically. It's really easy for people to blame things on age, but if it can help their body function better as they age, like I call that a plus, you know? I don't think people should kind of give up on their bodies a bit as they get older, and some people do, but then again, I definitely have older clientele that they want improvement, they want to move as best as they can for as long as they can, right? And that's where with the acupuncture, once again, how do I massage a joint? If somebody's arthritic, if I can get into that zone, like the example with the knee MRI, that's a great example of if I can needle in that area and get that joint to feel a little better or work a little better, that might help somebody have a better quality of life.
Okay.
Well, you're all here and nobody had any coffee or snacks, so like, there's all this food back behind you guys, so like, yeah, there's stuff on the shelves. It's just a bunch of us that work here or use space there. We have homemade soaps. Marat, he was just here, but he snuck out. He brought in a bunch of incense to sell. I mean, so we have stuff on the shelves. And then snacks, you know, meander a little bit, talk to each other, ask questions, whatever you want to do.
Well, thank you very much.
Yes, thank you.
Yeah, thanks. As I said, sorry, I like the approach of it. I'm like, I don't even know if I had this organized, the slides the way I wanted to, but I mean, Jeff just edited them this morning. I was like, I know there's typos. He just kind of ran out of time.
the content, really.
Yeah.
And even, some of the other things like the carpal tunnel, of course, yeah, I've got that too.
Right.
Right?
Yeah.
Yeah.
So, no, like I said, it's an interesting tool that I've been adding in.
So would you continue like the massage every month and then you would maybe every other month do the acupuncture? How does that get, or is
Well-
acupuncture a one-off or?
Well, they always call it like the 10 treatment rule.
Yes.
And I know that's really hard for people to keep up with, so how I look at it is, if it's a pain management thing, I feel like I can pretty easily do like either 2 treatments a month or alternate. So like, let's do acupuncture, look at this and address this, see what your progress is.
Yeah.
Go back to massage to kind of maintain it. Now, it gets a little more complex when say somebody they're trying to conceive, they have a gynecological issue, something that's really long-term, reoccurring, treatment needs to be more consistent. Same thing with quitting smoking. I'm working with
Yes.
somebody with that right now, and that being said, because they only can get in so often, and I just hope that it helps, you know, when she comes in, if she runs out, I give her ear seeds, so at least it's on
Right.
those points. It's
Yes.
consistency is really important with certain things. Other things, like, we can break it up with massage. That's how I look at it, so, yeah.
Awesome.
Yeah.
Wow, this was, thank you.
Yeah, no, you're welcome. Got the lights on? Yeah, I don't even know how you had this set up, I'll let you, I'll let you figure